Hi, I'm Dr. Matt Anderson. I'm one of the physicians here at Recovery Ways. I have been in charge of working with the group to make sure that we keep the risks of COVID low here at Recovery Ways. And we've done a lot of things, instituted a variety of ways to do that. Before everybody comes into Recovery Ways, we test all the patients. And we can provide tests, we can send them in the mail to you, we can work through your local health department and make sure that you get tested. And any other way that we can, we'll get a test as quick as we can before you come in. We have a variety of ways that we can test patients and staff. We have a collection of two different types of tests, both saliva testing and antibody tests that we have in stock here ready to send. Additionally, we have the PCR testing, which is the nasopharyngeal swab that has become the most popular way of testing for coronavirus. That we have available here at two local facilities within blocks of Recovery Ways. So we can send you, we will give you a ride down there and test you. We use those variety of testings because we want to make sure that the appropriate test is done in the appropriate scenario so that we get appropriate results and act on it. Once that test is performed, the patients are coming in and getting evaluated. We have various safeguards to keep people safe once they're in here. One of the things that we do is we do thorough sanitation through the facility. We clean between every patient when patients come into the office, and we've been using a fog in order to clean and sanitize the facility. Recovery Ways provides masks for all patients and all staff, and we require everybody to wear them. We have read the data. It shows clearly that the use of masks can eliminate or decrease transmission dramatically. So we provide those. We have a variety of different kinds of masks to make sure that you're kept safe and find something that's comfortable for you. Interactions with staff are done in private offices that are sanitized between visits so that everybody is not exposed to anybody else's potential infections. We have medical staff with nurses and several physicians here who are able to evaluate symptoms immediately. We get a test done, and if someone does come down with even the mildest symptoms, a sore throat or a cough, we put them in the room, isolate, and bring them to groups through Zoom or another method, using electronic media. So we make sure that you're continuing to get groups while you might isolate a couple of days in order to get a test. If we do get positive tests, we have a separate facility that we use that is sitting empty now. It's already set up as a quarantine. We've done some construction in order to make it that way, and it is ready in case someone does come up positive. They can go to the separate facility. We have separate staff so that the staff that works at the quarantine is not working here, and in the case that we have to initiate that, we'll make that happen and make sure that people are getting treatment and they're being kept safe with a nurse that's 24 hours here in the facility. Coronavirus has become something that is a part of our society now, and we want people to come to treatment and feel safe. We want people to come to treatment and be safe, so we've instituted as many things as we can to reduce that risk. We try to prevent it from coming in with any new patients by testing them before they come in. We prevent it from coming in through staff by watching the staff and their particular symptoms. If they get anything at all, we have them out for a few days and we test them. We also keep staff away from others by enforcing social distancing when they're at home or when they're on vacation. Additionally, we want to make sure that the common areas are cleaned on a regular basis, and we want to use something that's low risk to the patient. So we use a formula called hypochlorous acid, which is an acid that kills the coronavirus but is non-toxic to humans.